Hello, folks. Welcome. Good morning, good afternoon, good evening to everybody joining, and welcome to Strength in Numbers, a global breastfeeding collective, UNICEF and WHO webinar for World Breastfeeding Week. Today, we'll be discussing how monitoring breastfeeding policies and programs creates accountability and empowers change. I'm your moderator, Pippa Horton. I'm the co-founder of a small company, Stone & Seed Creative, and before starting this venture this year, I was with WHO for 8 years, with breastfeeding communications as one of my focus areas. But definitely my most relevant qualification for this webinar is that I'm currently a breastfeeding mother. I'm currently feeding my second child at 18 months and with absolutely no end in sight. Thank you all for joining us today on this important topic. Before we start, I would like to remind everyone of some of the housekeeping and Zoom etiquette. So if at any point during today's webinar you're unable to hear the speakers, please make sure you've connected your audio by selecting the headphones icon. Closed captioning in English has been enabled for this meeting. If you'd like to view the live English subtitles on your screen, please click the CC icon or show captions and select that to turn on live captions. Please also note that this webinar is being recorded. You can submit your questions for the panelists in the Q&A box, which you will find at the bottom of your screen with the little speech bubble icon. So please direct your questions to a particular panelist if possible. Panelists may reply to your questions via text in the Q&A box, or will answer your questions during the live Q&A discussion portion of the webinar. This webinar offers interpretation in Arabic, Chinese, French, English, and Russian. To switch languages, just click on Interpretation below and choose your language. So without further ado, we can move on with the webinar. And we're very grateful to have Dr. Francesco Branca with us today to deliver the opening remarks. Francesco is the Director of the Nutrition and Food Safety Department at the World Health Organization. His full bio will be shared in the chat. Francesco, over to you to open the webinar.
Good morning, Pippa. Thank you very much for the introduction. I'm afraid I cannot switch on the video for some reason, but I'd like to really wish good morning, good day to all on behalf of WHO and UNICEF. Really, I would like to welcome all participants, speakers, and panelists to this webinar on the occasion of World Breastfeeding Week. What is World Breastfeeding Week? It's a celebration that we do since 1992, and we celebrate the 1990 Innocenti Declaration. Each year we have a separate topic. We advocate for a component of our work to promote, protect, and support breastfeeding. And this year, the topic is closing the gap, breastfeeding support to all. Why breastfeeding support? It's absolutely valuable for women to receive this support in the appearance of a problem. Having somebody to go to advise is absolutely critical. And women who don't receive that, quit breastfeeding, even if they want to continue. WHO recommends that at least 6 breastfeeding counseling contacts are established starting from pregnancy. And unfortunately, more than half of the world population, 4.5 billion people, do not have access to comprehensive health care and to counseling by expert breastfeeding counselor. And that's the other important topic. We need to have adequate number of well-trained breastfeeding counselors that have to be trained and mentored. We don't have enough of them. In this last 12 years, we've seen remarkable progress in breastfeeding rates. 10% more infants under 6 months are now exclusively breastfed. And we've almost reached the global targets of 50%. We are at 48%. Why is that? Because of the implementation of policies such as breastfeeding education, the breastfeeding support, but also protecting from harmful marketing, from the aggressive marketing of infant formula, the breastfeeding counseling, the family-friendly employment, the baby-friendly hospital. So the implementation of this package of policies is really making a big difference. And I really would like to acknowledge the wonderful collaboration that we've had in these years with the World Breastfeeding Collective, which brings together more than 20 organizations that are all from the UN, from civil society, that are all active in advocating and supporting the implementation of these policies. And let me close by really a call to action. And this call to action is really to work together on system change, to create that critical environment to promote, protect, and support breastfeeding. With this, again, I would like to welcome you to this webinar and looking forward to working with you in these years to further improve breastfeeding rates in the world. Thank you.
Thank you very much, Francesco. And we're now going to hear from some of the most important voices in this line of work, and that's the mothers themselves and their experiences.
When I delivered my first baby, a lactation consultant saw me each day. That made me feel really empowered. During my second delivery at a different hospital, I had to fill out a form to request a visit. None of the nurses offered me breastfeeding help. The way I felt at discharge with my first baby was very different than how I felt after my second baby.
Initially, it was not possible to manage work and breastfeeding. I have taken 6 months leave so that breastfeeding could be done in a proper way.
La verdad es que tuve que dejar mi trabajo porque no puedo dar de mamar y estar trabajando a la vez.
Maternity leave is absolutely crucial for breastfeeding.
Ce qui m'a véritablement aidée pour réussir cet allaitement, c'est le fait d'avoir eu la chance de pouvoir prendre un congé parental de 6 mois.
Essa história é muito bem sucedida. 2 técnicas de enfermagem que souberam lidar com o problema.
There was only one person available to help maybe 60 women at one time with breastfeeding.
Our healthcare providers were there to offer help and encouragement.
The doctor prescribed formula. I had strong intention of breastfeeding my baby.
Recebemos sim o suporte adequado da equipe de enfermagem. Eu sou muito feliz e muito grata por uma experiência privilegiada.
En el centro donde di a luz no me prestaron ese apoyo.
Being bombarded by formula advertising enraged me. I was having formula pushed on me by healthcare providers.
Creo que la información sobre usar fórmula está por todos lados. Traté de hacer caso omiso a toda la información que me decían por todos lados de que no iba a poder dar leche.
I definitely noticed a lot of unsolicited adverts for formula on my social media. I don't recall ever searching for formula.
My maternity leave has allowed me to continue my breastfeeding journey.
I work for an organization that is incredibly supportive of breastfeeding, and so my maternity leave was never a hindrance to my infant feeding experience.
Free samples were not allowed in our institute at all, so we were on track for breastfeeding.
Huge thank you to all of those mothers who were willing to share their stories. It's so important to see how much having that support can affect someone's experience breastfeeding. Now we'd like to hear from you, our audience. There will be an interactive question that will be shared on screen. So we'd like to start with you having a bit of your say. You can do this by visiting Mentimeter, mentimeter.com, using the link in the chat with the code 61360332, or you can use the QR code in the corner of the screen. And our first question for you today is, how could better monitoring of breastfeeding programs and policies improve outcomes for mothers and babies in your country? So jump in if you can. It's Mentimeter, MENTIMETER.com. The code again is 61360332. And as soon as some responses come in, I can share some with you all. So to understand what needs to be done, it would help to identify gaps to bridge. Absolutely. We'll keep having a look at some of your responses. It will incentivize change and create systems of accountability. Yes. And also it will ensure that investment of time, money, and energy is directed in the right and best way. Absolutely. Let's have a look at some more of these. It informs advocacy for decision makers, reduces wasting and stunting, which is incredibly important. Some others. It will provide us an opportunity to track progress. Absolutely. And we'll be talking a lot more about that during this webinar. It measures what is valued. Absolutely. It will help sharpen effective modifications. Will enhance support and education. Absolutely. And to know how, where, and when action needs to be taken. Yes. So there's so many different ways that monitoring can start to improve outcomes for both mother and baby. It will ensure that families are more likely to receive evidence-based information about their infant feeding choices. And yeah, I think that one's absolutely critical when it comes to families, especially because at that time it's very difficult to know which information is the right information, and you are receiving information from every different angle. So yeah, really important. It helps to encourage employers to put the right measures in to support breastfeeding leave or on site. Yeah, absolutely. And we know that breastfeeding leave is absolutely crucial to ensure that women have the support to be able to breastfeed for those first 6 months exclusively. Accountability of health professionals, government systems, and improves outcome for mothers and babies. Absolutely. There are so many excellent answers in here. I will read just one or two more and then we'll keep going on, but I encourage you to keep looking through these. So it can support breastfeeding, increase breastfeeding and decrease BMS, protects mothers' choice to breastfeed. Absolutely. And it can help with skilled care at the time of birth, which is severely lacking. Yeah, there's some really amazing answers in there. And I think that it just goes to show how much of a big impact it can have on a global scale, but also for every, as we say, behind every statistic is a mother trying to reach her breastfeeding goals. So absolutely, it can have a huge impact. So keep putting in your answers if you would like. And in the meantime, we'll move on to some of our presenters today who will take us through the concept of monitoring and the tools available for us to improve our monitoring of breastfeeding. So please feel free to use the Q&A box in this meeting to ask any questions that you might have for the presenters. They will do their best to answer in the Q&A box function. And later in the webinar, we will have a Q&A session, so we will also answer some of them there. So please do use that function. I'm very pleased to have with us Dr. Cecilia Tamori, Associate Professor at Johns Hopkins. We will share her full bio in the chat. So over to you, Cecilia, to take us through what monitoring is and why it's so important.
Thank you so much for having me, and welcome everyone. Thank you for joining us for this wonderful webinar. So today I will be talking about monitoring to enable breastfeeding equity. So I wanted to start by asking, why do we care about monitoring? Why are we so focused on this for this entire talk? Well, let's take a look. Every person's lactation journey matters. You've heard from all the mothers in our webinar so far about their experiences. Some of those journeys can look like the picture that you have here. It's a beautiful walk to the beach. And look, it's got nice paving. It's easy to walk. There's a beautiful green scene unfolding as you're walking to the beach. Next. This journey isn't just about how beautiful nature is here. It's also about how the various systems and structures make the journey what it is, right? So we can have this wonderful experience, but the way that we have that experience is about what the systems are that make that experience possible. One of the ways that this picture does that is that we have this wonderful road that takes us to this natural beauty. We also have an easy way for us to walk there. All of that takes investment, it takes thought, it takes systems. It's a little bit of a simplified picture of what we are dealing with every time someone starts on a lactation journey. Next. So our journeys can look like this beautiful picture, or next, or perhaps it could look like this. Next. When it looks like this, people are often barely hanging on. This is not exactly the same kind of journey. Both people might be taking a walk. Maybe they're both seeking a beautiful destination, but this is not the same as the other journey. It is not accessible to everybody. It takes a lot of training, perseverance, and specialized equipment that you might need to take to be able to make it to that mountaintop. And the systems that are in place here are only available to some people who are able to make it. Next. When we're talking about monitoring, it can help us build the roadmap to create better journeys so that they are more accessible, more available to everybody. Next. So let's take a closer look. Next. Why we need to think so carefully is so that we can understand each of the points where that journey that I just talked about, the lived experience of breastfeeding, intersects with the broader systems that shape it. Next. Monitoring enables us to track how well or how poorly these systems work to actually enable breastfeeding. Next. Ultimately, monitoring helps to inform policy decisions and also helps us determine the direction for changes we would like to make. Next. When we are thinking about that beautiful journey that we want to create, we want to think about what would success look like. What we want is for breastfeeding to be valued by society and to be recognized as key to public health and as a human right. In this wonderful landscape that we're creating, everyone has access to evidence-based information to make informed decisions about infant feeding. And those who desire to breastfeed can do so for as long as they want. For this to work, we need timely initiation of breastfeeding. We need to support exclusive breastfeeding for 6 months and then continued breastfeeding with other foods for 2 years or beyond. And ultimately, all of this builds towards better maternal and child health and ultimately the health of societies. Next. But the realities on the ground look very different from that wonderful journey that we are hoping to create. What we know is that most people want to breastfeed, yet fewer than half of babies in low and middle income countries are put to breast in the first hour. And we also know that about a third receive prelacteals. And those can be milk foods, it can be other foods, it can be water. But what we know is that when breastfeeding doesn't get started in the first hour, and when babies receive prelacteals, then we end up with delayed breastfeeding initiation, and we often start out on a cascade of supplementation that isn't necessary or even desired. And oftentimes, premature cessation of breastfeeding before people actually even wanted to stop breastfeeding. They set off a cascade and they may not realize that the cascade has even begun. Why this is of course happening is not up to individuals, but about those systems and structures in which people are trying to breastfeed. What we also see is that we don't have very good quality data, and we'll talk about that in the second part of this webinar, either in low and middle income countries, and some of our data is missing entirely in high income countries because they're not keeping adequate track of all these indicators. Again, monitoring can help us. We're also seeing major inequities across both regions and within regions as well. And you can see that on the graphs on this slide. Next. Another major threat to these wonderful possibilities is, of course, the promotion of commercial milk formula. The promotion of formula is very aggressive and it often is misleading and helps to steer people to misinterpret what is typical human infant behavior. What happens often is these behaviors are presented as a problem, even though they are part of a baby's normal behavior. And commercial milk formula is then presented as a solution to this problem that wasn't really a problem in the first place. This then leads us to that same cascade of unnecessary and undesired supplementation. And then, of course, self-reported insufficient milk. And ultimately, again, premature cessation of breastfeeding. And of course, these are just some of the mock-ups of formula cans and tins that you may see in your nation. Oftentimes, as we've documented extensively, these materials and the digital materials that surround them are full of misleading information that is poorly supported by scientific evidence. Next. Another major reality on the ground is, on the one hand, we're seeing some important, significant progress, as we heard in the introduction. So we started with about 37% in 2012 who were exclusively breastfeeding, and now we have made major progress. We're closer to about almost half of infants, and yet we are still not on track for meeting our goals for 2030, which should be approaching 70% exclusive breastfeeding rate. Ultimately, we want to shift those metrics up. We are also seeing, as you can see on this map, very wide variation across and within regions for exclusive breastfeeding. Next. What we know works is outlined in the Lancet Breastfeeding series that was published last year. And you can see that those outcomes that we started out, they are influenced by these systems and structures across different levels and different settings. What we need is for all of these pieces to work together for us to be able to have the results that we would like to have to build those better journeys. Next. In order for us to make this progress, we have to realize that breastfeeding is a collective responsibility. So it's all of us working together and supporting efforts in governments that have an obligation to invest in these systems and policies that actually make breastfeeding work. When we work together, we can see how each of these systems are working together, but we can also monitor how well they're working together. So we need to be thinking about monitoring across those settings, including health systems, including the work environment that you heard a lot about in the introduction, and of course, in the regulatory environment to address the commercial milk formula industry. It is this multi-sectorial collaboration and programming that is needed to protect, promote, and support breastfeeding, so monitoring has to take place across each of these domains. Next. Another opportunity for monitoring is to think about other systems in which breastfeeding is embedded. Breastfeeding cuts across many different systems. We need to be thinking about the ways in which it's integrated across these systems. One of the biggest areas is the ways in which breastfeeding is part of climate resilience efforts. And of course, that means many different elements that climate change is also affecting, and other kinds of threats, some of which are also driven by climate change. One of them is pandemics. We're going to be getting more pandemics over time, partly driven by climate change itself. We've seen how pandemics can disrupt entire systems of support. And so we need to think about integrating breastfeeding into these systems, and monitoring is a key part of that integration. Disaster preparedness is another, of course, partly driven by climate change. Once again, thinking about ways in which we can embed breastfeeding policies and support into disaster preparedness is key. Similarly, food security. Breastfeeding is a key pillar of food security, but is often not thought about in relation to food security. We can work to integrate it, and monitoring can hold us accountable for that integration. And of course, water security as well. When people do not have access to safe and clean water, that puts babies who are formula fed at particularly high risk. Breastfeeding is a key way to be more resilient, but is often not being discussed in that particular set of policies. Integrating across can help, and monitoring can hold us all accountable to ensure that each of these domains is integrated adequately and works properly to support breastfeeding. Next. We also need to think about the broader systems in which breastfeeding is embedded as a whole. Global inequities shape the landscape of breastfeeding that we have today. Local inequities also highlight how breastfeeding support, even within particular settings and all the structures that make it work, may not play out equitably. Of course, we know that conflicts, crises, emergencies, all of these things compound these inequities. And all of that shapes those breastfeeding journeys that we're talking about. So to fix this problem, we need to put breastfeeding in the center once again, and we need it to be recognized across systems and make it a social and economic policy priority. Monitoring, once again, is key to ensuring progress so that breastfeeding is centered appropriately. Next. So how can monitoring drive this change? We need to be listening to those diverse community voices through the entire process. We need to think about what are the trends at the population level and where are the inequities that we need to address. We need to be able to evaluate current efforts that are in place. We need to think about where are areas of improvement and what are some of the particular areas that really require prioritization based on the data that we are able to collect. That then helps us develop and implement the appropriate policies and the programs and that multi-sectorial collaboration that I was talking about. Together, we can then see with regular data collection and regular assessment that is cyclical, we can monitor this progress and adjust as we need, ultimately improving outcomes and improving equity. Next. And to finish up, how does this lead to change? Ultimately, the programs, the surveillance, the cyclical evaluation all feeds in to building that guide for equitable systems to enable the best possible supported lactation journeys globally, so that people no longer have to hang on to the side of the mountain, but when they set out, they indeed walk a beautiful path to the beach. Thank you very much. Next. If you would like to get in touch, I put my email and feel free to put some questions in the Q&A.
Thank you very much for that great presentation, Cecilia. It was particularly interesting hearing about these confusing marketing tactics, which can lead to misinterpretation of behaviours, because amongst my peers, I often hear confusion around the quality or quantity of milk, or the fact that their babies aren't happy with milk. So really, really interesting presentation. And now we'll move on to our next speaker, Larry Grummer-Strawn, who's the unit head of the Food and Nutrition Actions in Health Systems Unit, Department of Nutrition and Food Safety at the World Health Organization. We will also share your bio in the chat, Larry, so please take the floor and you can talk about the available tools and opportunities for improving monitoring. Thank you.
Thank you very much, Pippa. Good morning and good afternoon, everyone, and happy World Breastfeeding Week to you all. I'm happy to pick up really where Cecilia left off. She talked a lot about the need for monitoring, how important it is. So I'm going to go into a little bit more detail on some of the key gaps that we see in our current monitoring systems where we don't have the data that we need, but also some of the opportunities that we have where we can actually fill some of these gaps. Next slide, please. So to begin with, we need to understand we already have a lot of clarity on what needs to be done for breastfeeding. We have recommendations of how long breastfeeding should last, how it should be done, how to manage it in different situations, how to manage it over longer time periods with complementary feeding, what to do with special populations. We have policy frameworks laid out by the Global Action Plan, or the Global Strategy on Infant Young Child Feeding. The Global Breastfeeding Collective that's sponsoring this webinar has a whole series of policy briefs on what's needed, has laid out the key policy asks of what's necessary. We know what the interventions are, and they've been well evaluated and described as to what is actually needed here, and lots of implementation guidance on how to implement these things. And we know what kinds of indicators, we know what we ought to be measuring. So we've laid out a real strategy for addressing breastfeeding. Next slide, please. So the question is, how are we doing with implementing what we've all agreed needs to be done? Every year, the Global Breastfeeding Collective puts out a global breastfeeding scorecard to assess where are we in terms of our breastfeeding rates, but also what are we doing in terms of the policies and programs to support breastfeeding around the world. And we look at every country, get the best data that we can available at the time, and kind of chart how our countries doing in protecting, promoting, and supporting breastfeeding. We have periodic reports that are published by different organizations about the legislative status and in the policies that need legislation. So we know what's going on in terms of laws around maternity leave and workplace accommodations. We know what's going on in terms of laws for marketing of breast milk substitutes. We also have some basic data on the provision of support services. We know what countries have, how many of their hospitals are designated as baby-friendly. We have data on whether or not hospitals are observing breastfeeding of mothers in their settings. We also have data on counseling as to how many mothers are receiving counseling for infant young child feeding throughout the first 2 years of life. We know what kind of curricula look like. So at this kind of high level of what countries are doing, we have some information. We know what donors are providing in terms of support for low-income countries and when they provide donor assistance. And we have statistics on breastfeeding rates from a number of countries. So there are many places that we do have monitoring systems. We have data that's being reported regularly and being shared. But next slide, please. There do remain a number of gaps. There are places that we actually could do much better and need much deeper information to really shape our policies and programs going forward. So what I'm going to do is walk through kind of areas that are key priorities for us in supporting breastfeeding and see where we are in terms of the gaps, but also the opportunities for each of these. With regard to employment accommodations, while we have data on what legislation exists for maternity leave, we actually have no picture of who's actually taking that maternity leave. Even if it is mandated, does it mean that women are actually using it, or are there incentives that make it more difficult for them to use it? Is it actually reaching all women that need that maternity leave? Sometimes the legislation leaves out certain populations in the way it's written, and there are loopholes that women are not actually able to get access to the leave that they might need. And so we really need to understand who's actually taking that leave. We know what is mandated in terms of workplace accommodations, but we don't really know what's being offered. Our workplace is actually following along with the legislation if there's not the monitoring and enforcement to make sure that they're doing what they have to do. On the other hand, even if there's not legislation, there might be some workplace accommodations that are being offered. So we don't know how big the problem is if we don't build monitoring, if we don't collect the data. We're really working in the dark when we say we need to be providing better support. We need to understand what that support looks like and where we need to go from here. We also don't know what we're doing with the informal sector. Typically, our legislation only deals with women who are in formal employment. How are we supporting women in the informal sector? We have no information really collected across most countries about this. But we have opportunities. There are ways that we can survey mothers' experiences. Questions like this could be added into national representative surveys, such as the Demographic and Health Survey or other maternal and child health surveys. It could be put into World Bank economic surveys. Ways to find out what are actually mothers' experiences happening right now. As we started at the very beginning of this talking about, we really need to understand mothers' stories. What are the journeys that they're going through? We need to understand those journeys in terms of employment accommodations. We can also collect data from employers. There are surveys that have been done in some countries that actually are done on a regular basis, asking employers about how they're protecting a variety of employees' rights. And we can add to those surveys questions about how they're supporting mothers with breastfeeding. Next slide, please. When we then move on to talking about the implementation of the code, as we said, we have reports on what we have legislation on the code, but we have very little information on what's being done in digital marketing practices. This is something that is growing in our concerns. We have a new guidance out from WHO about how to deal with digital marketing in our regulations. But in terms of really capturing what is going on the ground, country by country, we really don't have a clear picture of that. We have long been asking for more monitoring of code violations happening in countries to make sure that the laws that are out there are monitored and enforced. And yet we continue to have problems building these ongoing reporting systems. We get anecdotal reports that there are violations happening, but if they're not being tied to enforcement actions, then we really don't know how well we're addressing the problem of these code violations. We know they continue to exist, but to what magnitude, what kinds of violations are happening, so that we can really clamp down on these laws is a gap for us. We also don't know what's happening in terms of enforcement. We know that enforcement is weak in many countries, but it's more by an anecdotal system. We don't have any reporting back of how many enforcement actions have been taken. Are they actually following up on violations that have been reported in the systems that are there, or just are even if it's not systematic, where we get reports that come in, are we taking actions on those? We don't have information about it. So in terms of the opportunities, WHO and UNICEF have published a toolkit of resources to help countries in building their monitoring systems so they can really monitor their violations and really connect that to enforcement actions, making sure that this is really done within the Ministry of Health, within the Ministries of Finance, within Ministries of Commerce, to make sure that we're connecting all of that together to make sure that enforcement does happen. As we look more and more at this problem of digital marketing of breast milk substitutes, there are electronic tools that can be used for this. Some of those kinds of tools are being used in some individual countries. We have key examples of artificial intelligence systems, screen captures to capture what kinds of ads are coming across people's phones. We have ways to scan the internet, scan social media to see what's actually happening in this environment. But those tools are not yet really being applied in most countries around the world. We have models for how to do systematic studies on what's happening in marketing by doing surveys of mothers, surveys of healthcare providers, going out and checking what is happening in the airwaves of television and mass media on the internet. But those systematic studies have typically been kind of a one-off on one country at a time. We certainly need to be collecting more data to really understand what does this landscape look like so that we can build stronger legislation, identify the problems that are there, and really target them with more concrete interventions. Next slide, please. We also need to be looking at the 10 steps to successful breastfeeding as a way to support breastfeeding early on in life, in the first few days when babies are born. While we have information about whether or not facilities are being designated in countries, we don't know anything about the actual practices. Even facilities that are not designated as baby-friendly might be actually carrying out a number of these 10 steps, but we have no way of knowing. Most countries do not have any ways of collecting data on this. We also don't know how health workers are able to support breastfeeding in the first few days of life. Do they have the competencies that are necessary to provide the appropriate evidence-based care that is recommended in the 10 steps? A number of opportunities here. We have new questions that have been incorporated into the core of the demographic and health survey. There are a number of indicators on some of the steps that have been added. And so as we get more and more of these surveys collected, we'll start getting better understanding of what mothers' actual practices are. But we need more than the demographic and health surveys. Using those as a model, those questions can be incorporated into other nationally representative surveys, other ways of collecting data from mothers themselves to really tell us about their experiences so we understand what is actually happening at a national level. Similarly, the Demographic and Health Surveys has a particular way of collecting data for service provision assessments to get more in depth of what's actually happening at the facility level. But so far, those surveys have not been implemented by most countries. That in-depth assessment actually covers all of the 10 steps in various ways, in different ways that data can be collected. Some models are out there for us to use. When it comes to monitoring at the health facility level, the district health information systems or other health management information systems are ways that we can collect data on what's actually happening in terms of the provision of counseling, both in antenatal care and follow-up care. There are questions incorporated into the new standard for DHIS2 that can be used as models here or can be applied directly within those models. Countries have the ability to make modifications to their own health management information systems. And so we really encourage them to include that so that they're capturing this data. We also have a competency toolkit that's been developed for understanding the competencies of health workers to see if they are actually able to provide answers, to provide more information on their abilities to support women during those first few days. Do they actually have the skills that they need? We now have the ability to do that because we have the questions and models for assessment. WHO is in the process, in collaboration with UNICEF, of finalizing a monitoring manual to look at the implementation of the 10 steps. It's a model that looks at internal monitoring within facilities so that they can track their own progress over time, external ways that we can look at facilities through quality assurance systems coming in and checking on our facilities, and also national data collection on the 10 steps. We really need to understand much better what's going on in this area so we know where to target our efforts. Next slide, please. Moving on to thinking about breastfeeding counseling. While we do have data on how many women are counseled, we have very little information about what actually that counseling looks like. How often does it occur? Do women get just a single visit or do they get multiple contacts? Do they occur during antenatal care? Do they continue out to 2 years of life when we want breastfeeding to continue through? Who's actually providing that? Are they skilled providers, or is this provision by people who don't have any appropriate training? Is it face-to-face? Is it on the telephone? Is it internet counseling? How long does it last in each contact? And what is the quality of that care? Is it actually being done in a way that's actually going to be helpful to mothers, or is it just giving them information that doesn't really answer their questions? In terms of opportunities here, as I said, we do have some new questions in this new module for nutrition in the health management information systems. There's certainly more can be added in that arena. We have more questions that can be added into nationally representative surveys. These are surveys that ask mothers about their birthing experiences. It's certainly a key opportunity for us to be asking them about what's happened to them in their counseling, both antenatally and postpartum. There's a new framework that has been published to try to really harmonize our measurement of counseling, to really get at these modes that I talked at the beginning of the gaps, that really tries to lay out what is the kind of information that we need. So we've really done the analysis of the necessary information. It's now a matter of putting that into questionnaires. So we're really hearing mothers' journeys. What is their experience with counseling going forward? Next slide, please. We also need to take a step back. Those are the specific intervention areas that we need to be focused on, but we need to understand this in a more holistic way. We need to see at a national level, are we putting our energies where we need to? Are we coordinating our breastfeeding portfolio of interventions across the different areas? Do we need to build much more for that? There are a variety of opportunities here. The World Breastfeeding Trends Initiative has been around for many, many years as a country-led process to evaluate its performance against the global strategy for infant and young child feeding. Has 10 different areas that gives scores on what kinds of things the country is doing. It's a self-evaluation, so there is some subjectivity to it, but it's an important conversation for countries to have on a periodic basis to really say, are we actually doing what we've been called to do? Are we implementing the policies that we're supposed to be doing? Are we getting appropriate funding to make sure they're being done well? And do that self-assessment on a periodic basis so that they can keep shaping their program going forward. This kind of monitoring is critically important. A similar model that's much more recent, called Becoming Breastfeeding Friendly, is a similar approach of bringing people together to self-evaluate their country, but it takes a somewhat different look, more about a more rigorous assessment, but looking at kind of higher level areas. What are they doing in terms of advocacy? What is the level of funding that they have? How are they doing monitoring at the country level? So it's a complementary perspective on really understanding our breastfeeding programs going forward. Another model that countries can take on to really do that self-assessment of how they're doing to support, protect, and protect breastfeeding. Next slide, please. And finally, with regard to funding, we have key gaps here. With regard to funding, we know what international donors are providing to low-income countries for their support of breastfeeding, but we have no data on domestic expenditures for breastfeeding support. And in fact, we don't even really know how to count that. Breastfeeding support is so integrated, it becomes a key part of nutrition services, parts of every healthcare visit for women and children, that really needs to have this built in. So how do we count that support? How much money does it need? How much time do we need to be spending and therefore pay for that time? We need much more guidance around how to do that. Some of the opportunities here are that there is the possibility of creating national line item budgets for breastfeeding that are needed to really address this problem, but then also to say, when it's in the line item, how does that money get spent? And as we can start understanding how those line items are being spent for breastfeeding, we can understand what the needs are and where the gaps are. The World Breastfeeding Costing Initiative is another model that has looked at what kinds of investments are needed for breastfeeding. And this is a way for collecting data on what is being spent now. How do we get that information? What channels is it going through? Who is providing the funding? And getting an understanding of that can really help us shape our advocacy going forward into the future to say, this is why we need more support. Here's where it can be used. Here's how those funds are going to be applied. That's why we need that. Next slide, please. So all of this is about the support for breastfeeding. How do we build the policies and programs that are needed to support, protect, and support breastfeeding and promote breastfeeding? Key gaps in terms of understanding the breastfeeding rates themselves, though, continue to exist. While we have key indicators that have been recommended in the manual on infant and young child feeding indicators, we continue to have gaps. Many countries still have not collected data on exclusive breastfeeding and continue to have long periods of waiting in between. So there's not recent data on what is going on. High-income countries, as Cecilia pointed out earlier, typically are missing these data. They're not collecting them often enough, or just not collecting them at all. Many countries have high-level statistics for at a national level, but they can't break that down to subnational levels, sometimes to a basic geographic area of provinces, but at the district level where decisions are being made, they're missing that information. So they have no way of saying, are we doing better with our programs or not? There's a real problem with comparability of using standard indicators. Some countries do collect data on breastfeeding, but they collect it in different ways, and we can't compare from one country to the next. And so it's really hard to understand how they would be benchmarked against other countries that are doing other kinds of monitoring. Key opportunities here are to incorporate standard questions into more surveys, whether it be the demographic and health survey or the multiple cluster indicator surveys sponsored by UNICEF or other household surveys. Most countries are doing household surveys of women in various ways, but they're not asking standard questions about breastfeeding. So we just need to add those into existing mechanisms. We also need to explore alternative data collection systems. Are there other ways besides household surveys that we should be collecting these data? We have the opportunity of the indicators manual, as I mentioned, that really lays out what is the standard we all should be adhering to. Next slide, please. So I just want to thank you for your attention today, as it is important for all to recognize that the protection, promotion, and support of breastfeeding is absolutely necessary. We need to do a better job, and what is needed is very clear. It's been laid out for all of us, but we need more regular monitoring so that we can have stronger advocacy, planning, targeting of our interventions, and evaluation of them. There are lots of tools available for how to do this stronger monitoring. We just need to take those tools and put them to work. Now is the time for all of us to really ramp up, making sure we're getting to know what is actually happening out there in the field. Thank you so much for your attention. Next slide. Thank you very much for your time.
Thank you very much, Larry. It is great to hear about those existing tools for monitoring and about the gaps you're trying to address. And following those excellent presentations, and now that you all have the hang of Mentimeter, we want to hear from you again. The question this time is, what resources do you need to improve existing monitoring of breastfeeding programs and policies in your settings? And as usual with breastfeeding topics, it's been a very rich discussion, so we are over time a little bit. So I encourage you to put your responses in there and interact, take some inspiration from some of the things that you see come up, and we'll move on. In the meantime, just to remind you, you can visit mentimeter.com and use the code 61360332, or you can use the QR code on the screen. So while you're doing that, we'll move on with our next presentations, and we're very glad to have two country representatives with us today, Mr. Han Long Bao, who is with the Department of Medical Service Administration in the Ministry of Health, Vietnam, and Dr. Nino Lomia, who is the head of Maternal, Child and Reproductive Health Division at the National Center for Disease Control and Public Health of Georgia. Both of their full bios will be shared in the chat, and please feel free to ask your questions in the Q&A box that you might have for the Q&A later. I can see that a lot of those are already being answered. So to our first speaker, Mr. Han, the floor is yours to provide your reflections on how Vietnam has used monitoring for national advocacy.
Good afternoon from Vietnam. It's my honor today to joining the World Breastfeeding Week and our seminar to present on the national quality of care environment and how we use the policy for breastfeeding monitoring program. My name is Khánh. Currently, I'm working as an official at the Department of Medical Service Administration, Ministry of Health, Vietnam. Our core responsibility is to support the hospital management system. And for me, I also support the regular conduct of breastfeeding monitoring. So next slide, please. So my presentation, we have the three main parts. The first one, I will deliver a very brief policy breastfeeding monitoring and how we are doing it. And also with the way forward, I will present later in a later part. Next slide, please. So similar to many other countries as well, Ministry of Health Vietnam, we also have a national action plan on reproductive health care, focus on maternal, newborn, and child health care in the period of 2021 to 2025, and we are revising it, and we also appoint for next year from 2025 to 2030. The breastfeeding also included in the National Action Plan, which I will share in a later part. Next slide, please. Yeah, one of the most important policy that we have successfully delivered in the past years is the National Code, which is we call it a Decree 100. We're governing the trade and use of nutritious products for infants, feeding bottles. This is the National Code issued by our Prime Minister. In Article 4 of the Code, it's an information, education, and communication document on nurturing infants. There are information and about the document regarding the breast milk substitute are banned and also are not allowed to advertise. And also the advertisement of nutritious products for infants is to strictly prohibit the advertising of breast milk substitutes for under 24 months infants. complementary foods for under 6 months infants and feeding bottles and teeth in any forms. And this is one of the most important national code that we have advocated in recent years. Next slide, please. Next slide, I will present the Vietnam Hospital Quality Assessment Criteria. So this criteria, it's applied for all the hospitals in Vietnam. And we have 5 main group from A to E, in which in group E, we have the obstetric criteria, which we have the E 1.3. It's a good practice in breastfeeding. This hospital criteria is applied every year by every hospitals, and they are mandatory to monitor it every year and submit their report to our department. And we also conduct regular visit to a site to see how they implement the good practice in breastfeeding. In the next slide, please. Yes, just I mentioned above, the hospital in Vietnam are obliged to conduct this self-assessment of hospital quality. And in all the obstetric and gynecology hospital, they also have the responsibility to establish a quality management system, and they will conduct regular monitoring on this breastfeeding criteria. Next slide, please. This is in our breastfeeding criteria, we have from level 1 to level 5. And in each level, we have a detailed criteria in hospitals that have to apply it. And the minimum for all the hospitals in Vietnam now is at least a level 3. Next slide, please. This is the photos that we conduct regular basis to monitor how the hospitals in Vietnam are applying the breastfeeding criteria, and also the breastfeeding consulting meeting, and also how we share knowledge in obstetric and gynecology system hospital on to consulting pregnant women on breastfeeding. Next slide, please. On the left, you can see a board, a Vietnamese word. This is the board on the regulation of the breastfeeding. And this is signed by the director of the hospital that we have to follow these 10 BHI. And also in the paper book on the right, the pink one is the monitoring book. And in the next years, we are trying to digitalize the monitoring book on the e-hospital system. Next slide, please. This is a key, I want to deliver the key stakeholders at the moment for monitoring in Vietnam. So from our side, from Ministry of Health, we have different departments in which the Department of Medical Service Administration is my department. And along with the Department of Maternal and Child Health, we are monitoring it from the top down level. And in every national, you can see from the left is National General Hospitals to the MNCH hospitals, subnational hospitals in provincial level and also in district level, and also in private hospitals. So this is a brief summary of how the Ministry of Health in Vietnam, we are conducting breastfeeding monitoring. And once again, it's my pleasure today to join to the webinar, and I'm very welcome to have the questions from all the listeners. Thank you so much.
Thank you very much, Mr. Han. It was very interesting to learn what is happening in Vietnam. And now we'll move to our second speaker, Dr. Lomia. So over to you to share your experiences on how Georgia has used monitoring for advocacy in your country. Thank you.
Good morning, everyone. It's a great honor to participate in this important event, Breastfeeding Week, and this webinar. I would like to share our experience, Georgian experience, regarding the monitoring of breastfeeding policies and programs in our country, and some outcomes of this monitoring and how we try to improve breastfeeding practices in Georgia. Next slide, please. Unfortunately, my slides are not so attractive as my previous speaker slides, but I will try to just explain what we are doing to enhance the quality of breastfeeding and prevalence of breastfeeding in our country. So this activity started in 1999 when law of Georgia on the protection and promotion of breastfeeding and artificial food consumption was adopted by Parliament of Georgia. Immediately after that, so administrative offenses code of Georgia included the articles, 2 articles regarding violation of the rules for the production and sale of artificial baby food products, and also advertisement of these products as well. In the same year, the law of Georgia of advertising was also passed, regarding prohibition of advertising of artificial baby food products. In 2002, in order to also strengthen the monitoring and of marketing of baby formula, the law of Georgia on the protection of consumers, a law of Georgia on broadcasting was adopted in 2005, and 2002 law of Georgia on protection of consumers' rights, of course, support these activities. So in 2005, also the same 2005 law of Georgia on medicines and pharmaceutical activities included amendments in line with the requirements for production, registration, and sale of these products and marketing as well in pharmacies. In 2020, we have adopted changes in organic law of Georgia regarding maternity leave. Labor Code of Georgia, especially Article 37, includes the defines the duration of maternity leave for mothers in Georgia. Unfortunately, it is mainly refers to the public facilities, and in private institutions we still have these problems because it completely depends on the goodwill of the owners of private institutions. Next slide, please. So regarding the governance and the accountability, mainly Minister of Health of Georgia lead this process, and in 2000, it was a minister's order was issued on the creation of the National Supervisory Council for the protection and promotion of breastfeeding and controlled use of artificial baby food products. So now this council is handed over to the MSH Council of the Ministry of Health, who also lead this process of monitoring and of breastfeeding practices in Georgia and enforcement of the law. In 2003, another minister's order on the rule of distribution of information, education, and training materials about artificial baby food products and consumption were issued. And in 2008, it was a great and profound reform in the obstetric and neonatology field of Georgia, because WHO effective perinatal care principles were introduced through the support of USAID support. And also UNICEF and UNFPA were also included in this reform. And these principles include implementation of warm chain principles, which everyone knows that it includes rooming in, early breastfeeding initiation, and so on and so forth, skin-to-skin contact, and so on and so forth. In 2016, it was also very important activity. Georgia Birth Registry was introduced in the country, which allows us to collect information, collect data on a routine basis about breastfeeding indicators. In 2017, Georgia government approved national maternal and newborn health strategy with action plans for 17, 19, and 21, 23. We're going to update this action plan at the moment, and which includes indicators for breastfeeding as well. Which we also, of course, track, and it helps us to monitor breastfeeding practices in Georgia. In 2017, it was also related to the reforms in maternal and child MCH field. Regionalization of perinatal services have been implemented in Georgia, and it includes, unfortunately, Georgia does not have the continuous medical education, mandatory continuous medical education system, but for this perinatal care field, it is mandatory for healthcare providers. And these continuous medical education courses include also breastfeeding modules. In 2022, it was we have updated guidelines on breastfeeding. One is related to the guideline in the maternity hospitals, and another one guideline and protocol regarding the baby feeding up to 2 years of age. Next slide, please. In terms of governance and accountability, it was a very important recent, exactly on the basis of the monitoring and data-driven, decision making was done, made regarding with our state program. Didn't cover postpartum visits for babies, for both mothers and babies. We have 8 visits, antenatal visits according to WHO, but we have added one more postpartum visit for mothers and babies, and it is covered, and so it also includes the counseling of mothers regarding breastfeeding. Also in this relation, in 2023, another change was made in the law, in the state program, that we have changed discharge rules, and now all the neonatologists in the maternity hospital are obliged to register in the birth registry the primary healthcare facility, which will take over the baby and mother for registration, and they will follow up their health. Very important also activity is that from 2024, through the support of Japanese government and JICA, Georgia is going to implement maternal and child health handbook, which is based on the home-based reports, and which allows us to increase communication between patient and physician communication. And this book will include, we are now working on the content, and includes all advantages of breastfeeding and we will monitor the breastfeeding practices of mother, her concerns and everything, because it is based on home-based, her reports, and a physician provider can monitor and give counseling and provide counseling and feedback to mother regarding this. Next slide, please. From the provider side, professional associations, NGOs, and maternity hospitals, what we have there. So first of all, in the beginning, of course, the trainings for providers, healthcare providers, both physicians and nurses were conducted on the 10 steps of successful breastfeeding in the beginning throughout Georgia. Then to 14 maternity hospitals were designated the baby-friendly hospital, maternity hospital status. However, right now, this is our big gap where it has been suspended, so we're going to resume this process. Then it is very important that along with the implementation of effective perinatal care principles, we promoted and educated the establishment of parent schools in the maternity hospitals. And now, of course, it needs some improvements, but still there are many maternity hospitals include these parent schools in their facilities, and parents, not only women, are able to attend these classes, and it also includes of course, breastfeeding module. And this curriculum was updated recently through the support of UNFPA. Then in 2021, it was very important that our Neonatologists Association of Georgia, they conducted the assessment, multi-sectorial assessment of the breastfeeding policies and programs in Georgia. And based on their recommendations, one of their recommendations were to update the guidelines according to the international standards. And based on these guidelines, now the trainings are ongoing for healthcare providers, both on maternity hospital and antenatal care providers and primary healthcare providers, which is also very important. And I will add also here that pre-service curricula, so like university curriculum was also updated for 6th grade students. Next slide. So here are the data on the basis of which we have conducted such changes and activities. So the 3 reproductive health surveys were conducted through the support of USA CDC, and here we see that breastfeeding practices improved from 1999 to 2010. We also see some differences, some improvements in the duration. And here we see the initiation was improved of early breastfeeding. Then here we see also that it's duration of breastfeeding, any type of breastfeeding have been improved. Next slide, please. And in 2018, we have included this multiple indicator cluster survey supported by UNICEF, included, of course, the questions of regarding breastfeeding. According to this survey, prevalence of breastfeeding is high, but still early initiation was quite low. And there is also exclusive breastfeeding prevalence is very low, and there is also, we see some variations, rural or urban variations, variations based on the wealth status, education status of women, and also a variation by the type of delivery, vaginal or cesarean. Of course, vaginal up to delivery, breastfeeding is higher. Next slide, last slide, please. And now we collect this information based on the birth registry, and we see that there is some plateau of prevalence of breastfeeding, both early and discharge in the maternity hospitals. That I have to underline also that breast registry provide information only until discharge of mothers and children from the hospital. And we are going to add another module, electronic module, for the registry up to 5 years for children up to 5 years of age to ensure some continuum of care and monitor and track the indicators, including for breastfeeding. And still we have that there is a big difference, some difference between vaginal delivery and C-section, after C-section breastfeeding, because the main reason is separation of mother and child during after C-section, which violates the rule of rooming in like principle, and we're going to address this issue as well. Thank you very much. Next slide. Thank you very much for your attention, and I'm ready to answer your questions.
Thank you very much, Dr. Lamia. I'm now going to ask Mr. Han and Cecilia and Larry to join us back here on camera, please. And we're going to have some questions and answers for the audience. So it's back to you, the audience, and thank you to our experts for already answering. I can see a lot of the questions in the chat, so in the Q&A section. So please do pop in there, pop your questions in if you have something to ask, and we will try to get to as many of them as possible. So the first question that I have is for Larry. How do we counter aggressive advertisement of breastfeeding substitutes and lack of commitments from governments in enforcing the breast milk substitute policies for political and economic reasons?
Thank you for the question. Certainly, it's a challenging arena. I think that the standard answer that we always have in addressing the challenges with marketing has to be in the legislation. While there's small things that we can do on the sides of calling out the companies in the media, reporting on them, trying to put pressure from other sides, in fact, we really just have to have a legislated process. What that means is we need to have strong legislation that covers all the different aspects of monitoring, of the marketing, and build into that monitoring and enforcement mechanisms in the law. What we see in many countries is that they have good legislation of what's not allowed, but then they don't have monitoring and enforcement processes built in. And therefore, it's up to each government to say, well, how are we going to enforce this? And the political processes start kicking in. The lobbying happens. It becomes very bureaucratic and difficult to enforce. It really needs to be built into the law from the very beginning. What that means is that we have to have really a strong effort to build that law in the first place. There's going to be effort. We know from country after country, industry influence steps in. They try to interfere with the passage of the law, with making sure that it's weakened in all the ways that we can. And that means that we have to marshal all of our lobbying forces ourselves to get the coalitions together, working toward legislation, and call this out in the public that this is something that we have to do to protect the health of our mothers and babies. You're on mute, Nippa.
Apologies. Thank you very much, Larry. And I'll ask another question to you, Mr. Han. How is monitoring impacting practices, programming, policy, or legislation in your country? And how have practices changed as a result?
Yes, could you hear me? Okay. So thank you for your question. So for the past years, since we received support from international organizations like UNICEF and the WHO on how it's important at breastfeeding, in the Ministry of Health, we conduct also studies, and we establish, as I mentioned above, our hospital criteria. And from 2013 up to now, the hospital criteria is still in, and it's our ministry's a very effective tool whenever we need information and we need evidence-based results. So that we can put more, show it to the higher level for legislation progress. So to sum up, this is how Vietnam is on track with the breastfeeding monitoring. And in fact, at the moment, we do not receive any like fundings or from international organization to promote this. This is how the government are aware of the importance of advocating for breastfeeding. So just from our point of view, yeah. Thank you.
Thank you very much, Mr. Han. And another question for you, Dr. Lamia, after that excellent presentation. Can you tell me what can other countries learn from your experiences in improving monitoring in their own country contexts?
Thank you for the question.
Thank you for your question.
Apologies, sorry. The question's for Dr. Lamia. Thank you.
Okay, thank you.
Thank you for the question. Very good question, and it is very important to share experience between countries and the best practices, of course. First of all, as already has been mentioned, it is very important to have a high quality data regarding breastfeeding practices. So about the birth registry helped us a lot to collect this data. Although, of course, the quality needs always to be assessed and periodically do the audit of this quality of data, because sometimes providers do not provide this information, and we all a lot of times we have some missing data. But still, it's very important to have routinely to collect this data, and it helps us a lot to monitor the process. Another important issue is that to improve, it is very difficult to increase the awareness of our pregnant women and their families about the importance of breastfeeding. So I think that these home-based records are very important and communicate to strengthen communication between patients and physicians, and they can communicate their concerns about breastfeeding, their questions, their improve knowledge, understand that the importance of the advantages of breastfeeding. Because I can even provide example of my cousin's wife who doesn't want to breastfeed her baby because she hates the smell of the milk. I'm very sorry for this expression, but and they should understand that how important is breastfeeding for their babies. We tried several channels to increase awareness of women regarding this media channels, the TV and radio and so on and so forth. But I think it is much more, because they try to find some different channels in the internet, in the forum, and sometimes they can be victims of this aggressive marketing, digital marketing. So it is very important to have to receive this information for healthcare professionals and healthcare providers. During antenatal care, during postnatal care, in the maternity hospitals, and through this books. So this is my maybe answer to this question. There are many other things maybe we can share, but these two things are, I think, important.
Thank you very much, Dr. Lamia. And another question for you, Cecilia. It was asked in the chat, and I think it would be nice to discuss here. How can international breastfeeding advocates influence stopping promotion of formula milk for infants? Because the person answering the question has said it is a big issue in middle-income countries. Over to you.
So I think jumping off of what Larry said, obviously we want to make sure that we tackle some of the key policy foundations, and that's a starting point. I think one of the ways to get this going, though, is about raising awareness so that people actually understand why that change is necessary, and public support, building public support is an essential component of that. So it can be done through both sort of grassroots activism and working together, as well as, raising attention to the media, which is a key way that policymakers actually start paying attention to particular issues. So the more people are raising their voices about why this matters, actually can make a difference for policymakers who are listening to some of those conversations. The other piece of this is, of course, we can reach other groups of people in some ways easier sometimes than directly the policymakers themselves. So healthcare education is one of the themes that came up in many, many questions that I answered, and I think it's a perfect opportunity. It's one of the places that we can actually influence how we educate people, both about why breastfeeding matters in the first place, what is normal, typical human infant behavior? What are some of the tactics that commercial milk formula industries use that may be misleading and poorly supported by science? But also, what are some of the skills they need to have to be able to actually support people in this journey, because they're often lacking those skills as well. So there are so many opportunities for advocacy, and I know it can be really overwhelming, but working together and working through coalitions, communities, and groups is a much more powerful way than acting alone.
Thank you so much, Cecilia. And we are at time. We're asking you to stay for a few more minutes to wrap up this really rich discussion. But we have run out of time for questions. However, we're taking note of the questions in the chat. So please continue to put your questions if you have something burning there. And in the meantime, we think it's very important to hear again from our audience. So if you jump back onto Mentimeter, and I hope you've all got the hang of this now, you can use the link and the code 61360332 or the QR code that comes up on the screen. And the question this time is, a takeaway from this meeting, after all of those really interesting discussions that we've just had, how will you take action to improve monitoring of breastfeeding programs and policies in your setting? I don't know if the QR code is working. So if it's not coming up, we might just need you to jump on menti.com and type in 61360332. And I think that it's really important to hear from everyone one last time, because there's been so many interesting experiences shared. And in the end, what we want to do is for people to take this away and look into what can be done in your own countries in order to improve monitoring. So hopefully you've all received a few little gems from here. We have a couple of responses coming through. You can organize a WBTI core group. Keep drawing attention to the critical need for monitoring. Absolutely. So I think because we've lost the QR code, we might not be able to have as many responses here, but I'll read a couple more and then we'll move into wrapping up for today. And thank you so much for staying a couple of minutes extra. So we can work together within and among countries. Absolutely. Encourage and make accountable everyone in the sector. Start a data collection, working on food security and strengthening legislation, and supporting governments to review existing systems. Yes, absolutely. Great. They're starting to roll in now. So you've obviously all managed to get there. And hopefully you can use this space as a place to take away a few gems from other people of their thoughts and interact with that. Governments should have legislations and put bans on marketing breast milk substitutes. Absolutely. Collaborating with local breastfeeding organizations, working with the community, all really, really excellent points. So it's really exciting to see that there have been so many great takeaways from this, and I hope that you'll be able to jump into the Mentimeter answers and the question and answers and just have a look at some of the different things that have been taken away from that. So it's time to wrap up this excellent discussion. I just wanted to maybe jump behind the statistics again for a minute and bring it back home. So, you know, breastfeeding is a pretty wonderful experience, but when you're in the thick of it, it can be quite difficult and often lonely for many women. Most of us at different stages of our breastfeeding journeys are in a whirlpool of hormones, sleep deprivation, love, pain, brain fog. We have moments of pure joy, moments of complete exasperation, and we need support to breastfeed. We need support from our families, from our healthcare workers, from our employers, from our governments. So it's been really heartening to listen to these discussions and to get a better picture of the national and global actions that are being taken and some of the gaps to better understand breastfeeding trends and to support people who are breastfeeding. It's been a fantastic discussion today. I'd like to thank all of our panelists and speakers, and also to thank UNICEF, WHO, and the Global Breastfeeding Collective for hosting this wonderful event. There are many wonderful people also behind the scenes who put in an amazing effort to make today's webinar happen, so thank you all. And a big thank you to all of you in the audience for engaging in this important discussion and for making this such a dynamic webinar. So to wrap up, we'd just like to leave you with some actions that countries can take to help all women to achieve their breastfeeding goals. Firstly, to commit to systems level change that make it possible for mothers to breastfeed their infants when and how they want. To engage in monitoring of your advocacy, planning, targeting and evaluation. And lastly, to use data and evidence to create a facilitating environment for breastfeeding. So on that note, thank you all for joining. Let's continue to support breastfeeding women. Take care and goodbye.